Welcome to the Experience Shift, where we share insights for healthcare transformation.
I'm Brian Wynn, Senior Vice President of Growth at NRC Health.
And I'm Jennifer Barron, Chief Experience Officer.
Together, Jennifer and I will explore how the experiences of patients, caregivers, and consumers are changing the rules of healthcare.
We'll talk with leading executives, innovators, and thinkers who are challenging assumptions, turning data into action, and reimagining what healthcare can be.
So whether you are in the C-suite, leading a clinical team, or driving innovation, you'll find real stories here and strategies to help you lead change.
Let's shift experience, starting now.
Welcome to the Experience Shift. We're joined today by Dr. Wendy Swanson, a pediatrician, bioethicist, digital health innovator, and communicator. Dr. Swanson has led digital innovation efforts in hospital settings, built tools to bridge science and public understanding, and foregrounded the theme of trust in healthcare's evolving landscape. Please, welcome.
Thanks. Nice to be here.
So we're going to dig right in.
Yeah.
You actually launched the first hospital-sponsored blog. So you became involved in kind of the blogosphere and mis and disinformation and battling that very early on. You're probably a pioneer.
Yeah.
What got you interested in that, and why have you stayed involved in that space?
Yeah, I mean, we were kind of in the world of misinformation before we called it that. It came about for two reasons for me professionally. When I was a kid, I did a lot of performance. I played the oboe, which is a little bit ridiculous, but I did a lot of performance, and I did professional theater when I was in high school. So I kind of grew up performing and I think learning how to communicate at scale without really thinking about it. When I entered into medicine, through my residency training and even through my ethics training, my focus was really on kind of what's the dynamic of what we then called the doctor-patient relationship from what happens on TV. So at the time, it was kind of like Katie Couric goes on the Today Show in the morning. She talks about healthcare. What happens with how we consume it, how we understand it, what we believe about it, how we make decisions because of that. And so when I went into practice in 2006, that was really the dawn of the kind of acceleration of misinformation and mistrust really about the science and safety of vaccinations. And different messengers, it being Jenny McCarthy or someone else, would go on TV, say something, and then we would try to unpack it in our 10, 15 minutes of time that we had in the exam space. And it just became very clear to me that it was both inefficient. And I also had this feeling inside that was, am I really serving? So it wasn't so much like, am I serving the Hippocratic Oath? But I think about it that way of, what was I put on earth to do and how am I going to do it? It just seemed so obvious to me that I could communicate with hundreds or thousands or hundreds of thousands online, and I could communicate with one family at a time in clinic. And, we were just then, during my residency training at Seattle Children's, I was on service as an intern in the hematology oncology ward when we switched from paper chart orders into the electronic record. So I kind of grew up in the very beginning of how do we use digital technologies to increase safety, to make sure that we have checks and balances in proper ways. And I was trying to take it that next step farther of like, if moms and dads are reading on Facebook and spending time online, what are we doing isolated in the exam room? Mm-hmm. So that's why it was all super organic. It wasn't even so strategic at the start. I think the most strategic thing I did for my hopeful work in innovating was that I didn't just put a shingle up on the internet, that I partnered with Seattle Children's and they were brave enough to let me do that and to trust me in going freely and writing my own content, editing my own content, moderating my own comments, taking my own photographs, like doing all of it on my own. So it was deeply authentic. And I think, the leader at the time, David Perry, who was a leader in marketing and communications at the hospital, just got it. Yeah. And so was able to champion my work at the executive level so that people would invest in it.
The authenticity does ring true. When you speak, we can hear the authenticity. You talk about family, you talk about personal experiences. Mm-hmm. Jennifer, you do the same. Both wonderful speakers in your own different ways. One thing that I've heard you say that actually rings really true, and you don't have to be a parent to understand this piece, but you talk about when everything is going okay, you've got 1,000 problems. Mm-hmm. When your health is not okay, you've got just one. Mm-hmm. Maybe talk about that a little bit more.
Yeah, I read that, and I've heard it's attributed to different people who originally said that. but it does ring true. So there's, as people know, when we have any, it's like when something bad happens, a car accident, a fall, a bad moment in your life, often you remember it almost in slow motion, right? And some people think that that's because we make all these different memories in a heightened way during that time. When we get a bad diagnosis, when we start to worry about something in our life, or we feel deeply unwell and we get that sense, right? It's a funnel of light, right? It's like that funneling experience comes in where really context, perspective transmits itself with the loudest voice. And of course, as a parent, it doesn't matter if you're a parent or not, about yourself, your own body, or about somebody that you love, the minute that you think that might be under siege or under threat, everything else blurs out into the background, right? We take, of course, so we're lucky that most of us are able to take for granted the kind of miracle that our bodies work as well as they do every day. And of course, when they don't, right, pain comes in, which is there for a signal, but, tells us that. So I think my sharing that story today in the context of my son's cancer diagnosis and need for surgery, I mean, our life was completely transformed into thinking obsessively, right, of course, about solving this one problem. And all the little things from, my toe hurts to, I use the example I think today, like the lawn is ugly, or, I'm in a little fight with my neighbor, or I'm upset about politics, or it's like it all goes back into the background. Mm-hmm. And I think for those of us who are lucky enough to work in healthcare, we really do get to spend our lives building and making meaning and reducing and relieving suffering and anguish. I mean, that's, for me, what could be better than that, particularly having had to have those feelings myself.
Yeah, so Brian and I have talked a lot about, everyone's talking a lot about the digital space, AI, and how AI might relieve some of the transactional burdens that clinical providers have today. I watched a prior talk that you did where you talked about as a physician, I have to do 4 different jobs just to treat my patients. Talk a little bit about the complexities of that clinical space and your hope for technology in then allowing clinicians to build better relationships, and to your point, go back to that purpose of remembering why they got into medicine.
Yeah, I mean, I think people are, we were talking about callings. I mean, I think people are called to medicine for different reasons, and yet there's no question in my belief that it is universal that when you're lucky enough to be in a place of knowledge, to be able to help relieve someone's anxiety about something, pain about something, right, or not knowing what to do next, it is a privilege to deliver that information to someone. So if I think about the application of AI to the transactional aspects, there's an inordinate amount of other work that happens besides the direct patient. And, in this case, if I'm a physician with a patient in an exam room on their own, that's a perishable, highly valuable moment for both people. That patient and families think and worry and plan and strategize and block their calendars and tell their loved ones about the doctor's appointment. People go to their prayer circles. People go to their, they kind of go into the world, and then the moment happens, right? And without overly celebrating it, it is an exquisitely meaningful moment to be in the sanctuary of a quiet space where you can have a private conversation, divulge your fears, potentially your transgressions, whatever it is, right, that creates a sense of vulnerability, and have someone who, without any judgment, helps think through what's the best next decision, what's the best next step, et cetera. So that is, I believe, that sanctuary is what we all want to be preserved. Mm-hmm. So I reviewed some of the data from the Pew Internet Project and research really over the last few years of kind of looking at the shape of Americans' understanding about trust in what is AI going to do. I know that we don't want it to get in the way of our relationships with the human beings who deliver healthcare. I think we have to be smart enough to recognize that automation, often in talks I'll use the example of when my son Finn was like 6. I brought him down, I ran down, we had come home from work or the hospital, whatever, and I got him downstairs because Watson was competing on Jeopardy. And he was competing against Ken Jennings, like at the time, the biggest winner forever. Yeah. And they had like Watson just sitting there. It was kind of the advent of kind of commercializing and kind of imagining AI in your living room. And it was 2011. And I remember just being like, Finn, get down here. Like, we're going to watch a computer for the first time outsmart a human being at Jeopardy. And as a family, we watched Jeopardy, so it was like he was very familiar with it. But I did just want him in the room to see it, which now it's like, that's so elementary. Like, it's like, of course the computer can beat a human being, right? So I think that, but that being said, I remember thinking about that moment, and I used to say, hey, like, I always want a computer to help me think through the differential diagnosis. Like, I'm a smart, well-trained pediatrician, and yet, of course, I won't remember to think about everything, and I will have bias in the ways that I even think through a diagnostic journey or how to see it because of my just lived experience, right, and my own memory. So having a computer kick out what is most likely to be going on to then have me in the context listen, watch, observe, do physical exam, and bring it all together is the privilege of what technology is going to afford us. So that's, I think, we want to think of technology and AI as not just transactional replacement, but adjuvants, like really coming in and allowing humans to be more human, to be potentially better at being quiet and listening, to let someone get through the whole story because they might reveal the thing that'll crack the case, but also to ensure that the encounters that we get to have when we're together bring us both what we want. So if I'm a patient who's scared and needs help, I get help and I get relief from fear. And if I'm a clinician who has answers and access to resources or an understanding of how to navigate through a system, I get the feeling that I can do for this person and their family what I believe they deserve or what I want to help them do. And it's preserving that place for that exchange. Everything, I think we can't even imagine what's coming. I believe that. So everything else, yes. Let's raise our hands and let's try. Let's have the courage to do things that we've not done before. Let's listen to people who have lived experiences that can help guide us and prioritize. And then let's help continually figure out how to use free AI type resources to decrease the costs of delivering care so that we can preserve what is deeply valuable and, frankly, affordable. Some parts are affordable of being together and listening. Right. And sometimes they're inefficient, but they can be inefficient in a moment of time, but efficient towards a long arc of care in avoiding misses, right? In avoiding missteps in the beginning at points.
Right. But we do a lot of work on and study on trust, right? So from the consumer perspective, from the provider perspective, even from the executive leadership perspective, all right? And so there's a lot of different angles on it. Something like AI bubbles to the top a lot, right? What is the amount of trust that consumers are willing to put in something like AI? Do they believe it will make their life more convenient, make their diagnosis more accurate, whatever it may be? And I think the jury in some ways is still out. Like, we have not yet maximized that which we have at our fingertips. It'll continue to get better. But there's certainly some technologies that have worked to erode trust. And maybe, do you have any examples of those you could share?
Sure. Yeah, ready? Yeah, so number one, can I just talk about, before we get to the bad stuff, like, I believe, I think there historically was a very kind of maternalistic perspective of like, don't go, your Dr. Google's not as smart as my medical degree. Like these kind of doctors with their hands on their hips being like, don't Google your diagnosis, which I've always gone against. It's like, go Google your diagnosis. In fact, early studies even found that specifically for college educated people, over 55% of the time when they did that, they were getting to the right diagnosis that was ultimately confirmed by a healthcare provider or system. So I don't want us to be, kind of cocky that we still need to kind of hold these things in different ways. So, I love the advent of the internet for healthcare because it democratizes what we have access to and information. But the counter argument to that is the kind of infodemic that has occurred, right? Which is, it's not a lack of access to information, it's how do we get to the right information, and when we make our way there, who are we finding along the way? So if I think about bad actors in some ways are technology companies that have stolen our time and attention from us, have creative addictive tendencies towards these technologies to take us away from each other. I mean that in our personal lives, and I of course mean that in our lives in seeking healthcare even. The electronic medical record is an incredible tool for organization of information and connection And yet we have a long way to go where those tools don't provide friction at points, right? And provide harmony and open channels and provide kind of an ease and essence of, I can manage a small population. I can manage a narrow part of a population. If I'm a clinician, I can reach out to these people based on these filters. I can use audio or video or text because I'm, as a communicator, most comfortable with that format, et cetera. We're not there yet. And I think that we can be there in time. I also really think to the social media companies and technology companies as very complicit in bringing almost equalizing fact and fiction. That, long ago when it came to conversations about vaccine science and safety, as I began to do more and more media work as a health correspondent and contributor, or being interviewed as an expert as a physician, there would be like, well, we're going to kind of we're going to talk about the benefits and the pro-vaccine people and the anti-vaccine people, and they'd kind of put them against each other as if they were equal, as if data was equalized, when it was very clear that the preponderance of evidence is, of course, on the side of the safety of vaccinations and the benefit of vaccination schedules and programs that we have. So it was kind of an unfair divide. So the algorithms over time that these systems have created have disadvantaged, in some ways, boring, factual, drum data. Mm-hmm. And it has advanced and evangelized hysterical, dramatic, countercurrent, biased, quote, natural ways that have really confused the public to really understand, number one, who to trust and what to trust. And the algorithms and the technologies and their tactics have been complicit in creating this now enormous problem to who do we trust, who knows the most, who's really looking out for me or not, and how do I determine that? And what is my job as let's say I'm a mom, what's my job as a mom in parenting my child as they navigate through a health system of prevention tactics and care when they need it? And what's the doctor's job, or what's the nurse practitioner's job, or what's the PA's job, or what's the MA's job, and whose is whose? Because I think we've distorted that people think they need to do their own research, when in reality the way that they're going to conduct research or do research may just not be as systematic and effective as the research strategies that have been developed for centuries of how do we understand disease, how do we understand care and intervention, and how do we understand cure and reversal of pain and suffering. And it's like an enormity of pain, to have pain, and then to think that you have to double check everyone who's delivering the care for you. And I believe that has come about because of the infodemic, or because of even the democratization of information. One of the problems with that is that almost people feel like they have to do the doctor's job too.
Mm. And I think the conversation to get information out to people has changed. There are more and more influencers.
Yes.
And we are hearing from a lot of health systems that they're trying to figure out, how do we then combat that? How do we play a role in making sure the right information gets out? That's why I think your early blog is so fascinating, and you really were a pioneer, because we're hearing more and more the desire to have more clinicians online.
Yeah, I mean, I have been pounding that drum, ringing that bell. I mean, like, on airplanes all over for, north of a decade. Mm-hmm. And on some level, I've really failed. I started the blog, way back when in 2009. I wrote it for 10 solid years. I wrote over 800 blog posts. I put up 2 posts a week the entire time. So it was exhausting. And, I put my personal life, at least parts of my personal life, on display as a connector and engagement to say, hey, I'm going to go read that study. When I started working with, with the press, then I became part of the Associated Press. So then I had access to embargoed studies, so I could get them like the reporters would get them. I would get them a week before I could prepare it. I could think through narratively, like, well, what's the story to tell, or what happened in my own life to contextualize it so that it's a good story, but I can bring the data kind of into context for people. But most people don't have the time to do that. Mm-hmm. Systems haven't prioritized it. So I used to say, like, 10 years from now, the job of every physician in the United States will look really different. I had this belief that physicians would be sitting at microphones like this on a day-to-day basis, communicating to a larger population at once in this one-to-many way, and then they'd go back to see patients the rest of the day, but that they could communicate in novel, efficient ways so as to save them. I used to use the examples of like, we're back to like we're in the fall. So, with flu shots, every single child over age 6 months who doesn't have a life-threatening egg allergy is recommended to have a flu vaccine. We know that the data is very clear that that's recommended in a pediatric population. So every single kid that walks through the door all day is the same recommendation. And pediatricians and family practice docs and PA all over the United States every single day right now is going over the spiel about a flu shot over and over and over. I mean, waste, boredom, run of the mill. It's important because we still know that parents trust their pediatrician the most when it comes to vaccine science and safety. So that interaction is important, but the way that we're doing it is antiquated. The blog showed us how effective it was for me to reach a huge amount in the population, sometimes millions of people versus what I could do in the exam room. And, even the way that people tried to access seeing me, it was also people wanted to see me more when they knew how passionate I was and how deeply invested I was, and not just caring for my own children, but leaving my children to go care for other people's children, right? It was like who the workforce of healthcare providers are currently gets a worse rap than who these people are, right? And so that that transcended that as well. And I think what's interesting about what we're seeing with influencers and the threat really to the belief in science and the safety data that comes out of science from vaccines, but to other recommendations, we're for fluoride to vitamin supplementation to vaccination to car seats to even protection against UV radiation from the sun, that moms and dads and community members are more confused than ever because we're getting people who believe in science at the top, people who don't believe in science at the top. Everybody's communicating from these different pulpits in some ways that do hold a lot of power, but there is dissonance. And, I think health systems have an incredible opportunity to reinvent what's the kind of V3, not the V2 of health communications, but what's the V3? And I think that can potentially involve some AI-assisted tooling, and I think that can involve basically more integration even into the health record of how we broadcast and how we narrowcast and how we create bonds between patients and families who seek individual clinicians for care and those clinicians with efficient. I have a lot of ideas about this, but how we can build those tools so that they're more effortless for clinicians. So if we're using AI to scribe notes, and that's a transactional thing of it's taking away the time that I have to be in electronic record and typing out a note if I'm seeing patients. How are we then also in that same tool potentially or in that same moment taking one of those sound bites? If I just said it perfectly to a family about flu and it was somehow recorded, why am I not broadcasting that to the rest of the patient population to remind them to go in and get a flu vaccine and not saying it 24 times a day? So, I think there's a lot of opportunity to do that.
Yeah, it's actually a great segue into what it's a little segment we like to do called Executive Round. And it's sort of the same question that we ask to each one of our guests, and unique perspectives provide unique response. And it's about the paradigm shift that we're seeing in healthcare, and it's oftentimes aided. I mean, you have the headwinds and tailwinds, and you have technology that is both a disruptor and an enabler. And there's certainly transformation that's happening. And so maybe it's just an expansion on your V3, right? So if in V3, in healthcare continues to transform in the way that you hope to see it transform, what are we able to do?
Well, that's a nice question. Yeah. I mean, I hope I can put my creativity hat on and not be too limited. I think everything feels convenient. So I wake up in the morning, I feel good. I need to be reminded of how to stay that way. So I look at my data on my sleep in the context of the data of my community or the team that I work with to see, oh gosh, some people really didn't sleep well last night because we're at this conference, et cetera. And I need to have grace with that. And I need to recognize and be reminded and rewarded for that good sleep towards my protection against the development of dementia. The health reminders are there and embedded in my life. When I'm taking myself or someone that I care for, my mom or a child, to a healthcare visit, it's easy to get to the parking place. But if there's traffic and I'm running late, I can quickly in my car call or inform someone where I am and share my location until I'm there, so they can rearrange patients to make sure that I'm seen. So that not only am I not stressed about parking or getting in or not making it into that window of time, an appointment I've waited 3 months for, and ruining everything and clouding my ability to even communicate because I'm so stressed about getting there. It's just rearranged in a thoughtful way. A rubric that says, well, there are 20 patients that are going to get seen by this team in the afternoon, and 4 of them are here and 5 of them are there, and all those dots kind of arranged, and we can resort them appropriately for who needs what. So we triage with smarts and intelligence, not just for acuity of disease, but for convenience, experience, so that we trust before we distrust. So instead of having hard and fast rules about turning people away because they're 10 minutes late, instead of having an interaction like that, we constantly trust before we distrust, and we say, we have no idea what's going on in your life and how well you're coping and understanding, and how many different people had to take off work or move from school or pick this kid up, and all their other little mini tragedies happen to get us here, to get us back to the thing we talked about in the first place, which is the most valuable moment is going to be the time that we spend together. That we prioritize that in the health system. And so these people have, prepared for the visit. They've potentially virtually met the providing care team that's going to be there that afternoon. They've seen a video recording, not of just like why I go to work, not a doctor video, but potentially even a video that's about the disease or condition under the ICD-10 code for which they were referred. So long ago, we built a prototype of that called the virtual handshake at Seattle Children's, where we allowed basically surgeons to, for specific disease and conditions, provide education and information about that before the patient and family even came, and then we allowed them to bring other people into the room to read it. So if the mother-in-law was going to harp on the mom, be like, what did the doctor say? We could record it even in the visit, and the whole community could see it, so mom wouldn't have to do translating. And we did this 10 plus years ago. But I think the world is valuing that perishable time, and all of the conveniences are away. We're not slamming the phone down in a phone tree, what we have to hit through automated bots, but this conversational AI that we see a lot of investment outside of healthcare really works beautifully to take away the inconveniences of us getting to information and the people that we need, and potentially even be rerouted, right? Because we have wasted visits sometimes with the wrong people for the wrong reason because of the way something is referred or a wait time, et cetera. We could have machines that really learn when we kind of did the wrong visit or we wasted that, and that we could capture and deliver a ton of information to people asynchronously that we still don't do because we can't bill for it. Right? It's really hard to bill for things that we don't do in person still. And when we start to change that, not just in telehealth type solutions, but when we change it and we allow for systems to bill for and advance preventative tactics asynchronously, and then we allow for care to be given asynchronously and valued and reimbursed in equal ways, in ways that are convenient to patients and families and to clinicians, that will be, that would be amazing.
Yeah. Yeah.
Let's wave that wand. And then, yeah,
Sure.
that'd be good.
We don't do a lot that we don't bill for, right? Yeah. Well, maybe that's a.
Well, and I think, can I say one thing about that? I
please.
think that's part of why Seattle Children's with Seattle Mama Doc, the blog I wrote for 10 years, we were unique. It didn't ignite. There were other hospital systems that had some blogs that were run by marketing departments, still do, and have beautiful communication channels. I think that what people are craving, though, is right kind of from the mouths of the people that they seek and see. And what we have to think through is, how do we take someone who doesn't have a background in performance arts like I did coming into medicine, and maybe didn't study ethics and doesn't think about it the way I do, but thinks about the job of, they want to just take care of a panel of patients. They want to solve the problems, use their expert training to get as many people cured and cared for as possible. And how can we put the tools, microphones, video cameras, whatever assets it is, to capture how they like to communicate the most and deliver it to people who need it in kind of the easiest ways. I think that's the greatest good, because then the clinician with the expertise is comfortable and incented because they see that it saves them time and builds better relationships. And ultimately people can kind of, get what they need. But we do need to probably even return to that kind of 2010 type thinking of social media just showed up. It's like, okay, well, chatbots just showed up. I mean, Soros 2 just launched last week, where you can put yourself in a video and we could design any world we want, and we don't know if it's a real person or not. The time of, is this real or not, this discernment, that is going to be in the rear view window in a year, where you and I, someone could do a deep fake and it's you. This podcast could be recreated by tomorrow. No, next hour. This whole podcast could get recreated.
There's no way to know.
Yeah, are we real or not?
If we're even here or
I know.
not.
No, but that's real,
Right.
right? Our time, we're still in a time of discernment because the tools are relatively new, and yet we're going to be so quickly in a time where they're not. So that, of course, is a threat to who is the real expert and is the real expert doing this. And so, we'll also, of course, systems will need to get a handle on that to protect their experts and to protect trust because their experts are protected. And, we have a lot of work to do to figure that out.
Wonderful perspective.
What
Thank
a
you very
powerful
much. Yeah.
conversation. We could have talked for an hour. Thank you so
Yeah.
much for your time and sharing your perspective with us.
Yeah, it's a privilege to have been here speaking today and to use my own experiences to help anyone else. So thank you so much.
Thank you.